Hi, I'm Dr. Kapil Amarasinghe. I'm one of the accident and emergency consultants over at the Heartlands Hospital, Birmingham. For patients with suspected hip fractures, as a general rule, they tend to get flagged up to myself or one of my colleagues, make a quick initial assessment of them, determine if they indeed suspect that there is a broken hip. If we feel the primary problem is a hip fracture, we will arrange for the appropriate investigations. In this case, that would be standard x-rays of the pelvis and the affected hip.
Hi, my name is Kotha and I'm a senior radiographer.
My name's Charlotte and I'm a radiographer.
Within radiology, our role is to take x-ray images of your loved one's hip to confirm the presence and nature of the fracture.
So when your loved one is brought round to the imaging department from A&E, we'll take an x-ray of their pelvis and their hip. We'll do two different views. We have an AP, which is just from the front, so your loved one would just lie flat on the table. And the second one is called the lateral, in which we won't move the bad leg, but we'll raise the good one up and we'll take a side picture of their bad hip. And if they need any further imaging, they may get sent to other departments within X-ray, such as CT and MRI.
When the patient will then come back into a cubicle, we will then review those images to confirm whether or not a fracture is indeed present. If that's the case, we will be getting on the phone to the trauma and orthopaedic doctors who are on call and saying, could you kindly come and review this patient? I think they're going to be getting admitted under you. One of the other big areas that we deal with these sorts of patients who come to the department is pain control. We will also at some point generally do a procedure called a Fascular Block, where we will inject some anaesthetic into the affected fracture site or near enough to it to help block the nerves that supply the affected leg to really ease the pain. And we find that actually works a lot better than the injection-based medications and oral painkillers. And it just helps keep the patient comfortable while they're in the department, and also when they're being transferred across from trolley to bed and then, across from ward to ward and to theatre. So we do our best.